My name is Tony Chin-Quee.
And I'm Frances Mei Hardin.
And I'm friend of the pod, Ryan Montoya.
1, 2, 3, 4.
And welcome to Social Round, the podcast in which two of the happiest surgeon dropouts you'll ever meet, plus the ever-present Ryan, give our unsolicited opinions on the states of medicine, the world at large, pop culture, and whatever else we happen to find interesting. And he won't go away, guys. That's kind of how he does things. It's Ryan Montoya once again, a.k.a. Skin Family Supreme. And if you don't know that reference, it's very troubling, but you got to listen to the last episode. It's amazing. Ryan, welcome.
Thank you so much for having me again. You know, for any listeners,
Crazy
to be fair
intro.
to Frances May, to be fair to Frances May and Tony, they tried to get rid of me, but I locked the doors from the inside and I'm not leaving. I'm never leaving.
Mm-hmm.
These are my best friends.
He never does.
Yeah.
It's hard. And he hides well. He gets under stuff.
It's like a garden gnome. Yeah.
All right. So guys, just so you know, this is officially episode number 30. So we've been easily on the air for more than half a year. We've been spreading joy and you know, all the good feelings and all of the emotions to everybody. But, you know, Frances May, just from the boss's standpoint, are we doing well as a pod? Do we grow? Do we show, you know, signs of you know, somebody everybody should be getting on board this train right now?
Yeah, signs of life, for sure. I'm looking at, I literally pulled them up here.
There you go.
Last 28 days, 43% increase.
Whoa.
So actually a really blockbuster.
Amazing.
You know, I'd say blockbuster. And, you know, Tony and I have talked about this, but it is interesting. There's a lot that goes into the business of podcasting. And anytime somebody starts a new show, even if they've had other shows before, you know, in other contexts, anything like that, typically the ramp up is described as 1 year. At the 1 year mark, you can really say, oh, okay, perfect. Do we have a solid base? Do we get these consistent downloads, X and Y and Z numbers? But I think that we are very well poised. I think that we're cooking for some surgeons who maybe favor immediate gratification. Podcasting is not that.
But we're cooking in these streets right now.
Ahead
I like to hear that.
Ahead of schedule.
That's so great. I mean, I'm discovering new longtime friends of the pod kind of everywhere I go. People that I know who I don't know listen to the pod. They'll just be like, oh, last week's one was pretty good. It's wait a second. One of my buddies here in England who has nothing to do with medicine just looked it up one day and listens now every single week. And
That's awesome.
Does it make you wish that you talked less about orifices since all your friends are friends?
He's not walking that
more
back.
orifices.
No, he's proud.
More holes is what
he's
what the people
proud
seem
of
to
that
want.
episode. Proud of every single minute of that episode.
That's true.
Go ahead, Tony.
I regret no parts of any episode.
I regret nothing. Okay. All right.
All right. And also, I did want to shout out, 'cause we're talking about growth. You know, us reaching, you know, all sorts of audiences. I know that Frances May and Kate Burke, who was on the pod a couple weeks ago, they were just out at a conference together. And apparently, you know, it was really kind of a magical experience.
Yeah, it was wonderful. You know, shout out to Izzy, VP of Policy, but we were invited out to LMSA West, and the conference was at UC Davis last weekend, and it was wonderful. We gave, you know, a long form, hour-long PowerPoint presentation, and then an afternoon workshop with a bunch of case-based scenarios, all about the hidden curriculum of medicine and also how to succeed in the hospital when you don't look the way that maybe there are people out there who expect doctors to look. And so it was an incredibly wonderful experience. Obviously a lot of the most brilliant students applying in a range of specialties and everything. This is all about setting them up for success. And I mean, we do a whole thing on the myth of the meritocracy, right? Because as a pre-med, certainly as a med student, it's easy to think or believe well, if I work really hard, I get good test scores, I show up on time with honesty and integrity, that should all equal I am treated well and I succeed. And it's like,
Mhm.
okay.
Nope.
I
Nope.
wish that was the equation, but then we're literally sliding into the fallacy of fairness and like cognitive
Sure.
distortions. And so I just think that in order to best equip people to succeed, it's like, let's call it a spade, and then talk
Mhm.
about skills that will make you can be, and these will make you like just much faster and smarter and better.
I mean,
Sounds great.
this is honestly why we do this podcast, dude. Like,
Yeah. Yeah.
that's the reason why. Like,
Yeah.
there's a certain degree of comfort that comes with, talking about things that folks have gone through, and they can hear, man, someone else struggled the way I struggled. But there's something else that's really powerful about reaching the kids. Y'all are still, I apologize. You guys are adults too. But reaching the younger doctors who are in
Yeah.
training who haven't gone through
Yeah.
all the really hard stuff, and
Sure.
trying to give them the tools to recognize it before it kind of stomps them out. And
Yeah.
so I can understand, because those are conversations, those are lectures, those are chats that don't happen at the med school level. And I'm
Right.
sure like what you guys were feeling, because like, yeah, I heard from Kate that like there were some weepy eyes in the house, like it just like it's probably just from like speaking
Recognition.
Feeling seen.
feeling seen, speaking to an experience, life experience that everyone in that room knows to a certain degree.
Yeah.
But once they get into the medical world, which they're starting to, they're hoping isn't true. They're hoping that it might just be in their
Sure.
head, but it's very real.
Yeah, or even again, if you're at a great program in a great situation, how to be an ally to like not all your colleagues are going to be blessed with that. And I do
Yeah.
think like even at the
Mhm.
networking night, multiple young women said to me, wow, that was just like refreshing. This is the same thing as some feedback I've gotten on the book from medical students, which is that they literally
Yeah.
have written in and said, yeah, it was brutal at many times. I didn't find it depressing. It didn't make me want to leave medicine. It made me
Yeah.
feel empowered
Yeah.
to be in
Mm.
medicine. And it's like,
Yeah.
that's great.
Yeah.
And they just really said, I've never heard anyone speak so openly or talk about this stuff this way, to which, I guess they haven't met Tony and Ryan, but it is like a minority of
There aren't a
people
lot of
will
us.
get to hear this.
Correct.
I
Correct.
literally ordered online, and I'll wear it next week because it should be here by then. I have a new Dare shirt, because the best way to
Yes.
describe what I do is that I show up to all these, like, even the stops on the book tour, to these institutional talks, and I tell kids, like Dare program style, do not do drugs. You don't want to end up like me. And in my case, the drugs are like addiction to prestige and external validation and academic
Yeah.
achievement. But it's like the
Yeah.
same principle.
I'm
Scared
surprised you're
straight, yeah.
familiar with Dare. Like, you're like 10
Yeah,
years younger than me. Like, they still
Yeah,
were doing
yeah.
that?
It was still going
It's
strong
young.
in my like grade school. I mean,
Wow.
yeah.
Wow.
Wow.
Oh, good.
It
Yeah.
had long
Great.
legs. It had longer legs than the Reagan administration.
Yeah, apparently.
That
I was
reference
just-
does go above my head, though. That's an old-timey reference.
An old-timey president that you have no
That's
business
right.
knowing
That's
anything
right.
about.
I think it's amazing. The event sounds like it was amazing, and to have you and Kate as avatars, I think the crowd really lucked out. You're probably naming things, like Tony said, that people have experienced but just didn't have a name for.
Well, shout out to LMSA. And sorry, we never defined what LMSA is on the show
I think I did.
today. You didn't say what the acronym's for.
Latino Med Student Association.
Yeah.
I think we said it
Yeah.
off air. You're probably right.
Yeah.
Yeah. Just so people know. But yeah, shout out to LMSA, man. And yeah, everybody, if any of you guys listen to us, keep listening. We're here to support you guys. Everything we talk about is in some way to help everybody feel seen a little bit out there. And with that, I want to get into like a social round that I found really interesting. Okay, so
Mhm.
first segment, of course, social rounds. This is where we become your life attendings, because it's become abundantly clear that many of you guys out there are in desperate need of guidance, and we've got the kind of wisdom that only comes from running out of fucks. And the question of the week is, what do we do with the disrespect? Okay, so I just read this this Doximity op-ed by this doctor. Her name is Julie Schlegel, I believe is how you pronounce her name. She's a seasoned attending right now, but she was reflecting on this moment from back in med school where she was on her surgery rotation and she was in a room with a patient who was there for a post-op check of an inguinal hernia. For those not familiar, that's a hernia that gets fixed and the incision's in your groinal area. So it's in that part of the pull down your shorts so I can see area. And she's checking the incision on this older dude. And as she's checking the incision, he starts like making these noises, just like these kind of like, oh yeah, yeah, that feels
Jesus
good. Just like,
Christ.
and just like start saying that stuff, like, yeah, keep doing that right there. And like it's like looking at her and like
Fuck.
winking at her, like it's their little secret, like, and like context wise, like Dr. Schlegel is writing this, remembering this vividly, because this is like
Yeah.
it was a core memory for her. Like
Yeah.
she was 26, like a med
Yeah.
student in a room
Right.
alone with this dude who was like apparently looked like a cross between Colonel Sanders and Santa Claus. And she like remembers the color of his shirt, the way he laughed, like the way his intonation was, like all the things that tell you, hey, this was a massively traumatic experience for this person.
Yeah.
Right? Like
Core
that's how
memory, you
we
said.
remember those
Yeah,
moments,
yeah.
right?
Yeah, yeah.
So of course, like he's doing this stuff, he says these things, she shoots up and she walks out of the room, doesn't say a word to him. Uh, and then she goes on to kind of talk about the way, she's grown up, she doesn't tolerate that bullshit anymore.
Mm.
But it got me thinking about how, how many of us don't, like, especially when we're young, we don't have a toolkit for how to
Mm.
deal with a patient who doesn't respect you and you know it, in the moment. Like, and maybe
Yeah.
it could be because of your gender, could be because of your
Yeah.
age, your race, your accent, but whatever it is, like these people make it clear that you're not worth their best behavior. Right.
Mm.
And so what do you do in the moment is what I want to talk about, because I know we've all experienced that to a certain degree, even if it's just like you look too young to be a doctor. Like that's a thing we like people hear often, but it gets deeper than that.
Mhm.
It like, like in this scenario. So I'm wondering, like, if you guys could take yourselves back to, doesn't have to, we don't all have core memories of these things, but we have memories of these sorts of moments. And, maybe thinking about like how we reacted in the moment, or, how we've learned to react in these
Mm.
moments, maybe after we become more seasoned. I don't know, Ryan, you got anything on that?
So I was thinking about this because I have this story from med school. So I just started shadowing a primary care doc. So it was third year, my first rotation. I was working with this fantastic internal medicine doc, and he wanted me to pre-interview the patients. For folks listening, when you're in med school, you usually do the interview beforehand. You present to your attending physician or your resident, and then they go in together, and then the real doctors do their job. But anyway, my job is just to interview him. I walk in, this late middle-aged gentleman, no sleeves on his shirt, kind of gruff, a lot of tattoos. And I said, hi, my name is Ryan Montoya. I'm a student doctor. I'm here to interview you. I'm working with Dr. Lerner. Could you tell me what brings you in here today? And he goes, no, I don't want to talk to you. I'm like, okay, that's fair. Maybe there were cross signals and he doesn't want a student. I go back to Dr. Lerner. Dr. Lerner, by the way, is not working. The universal sign for people not working is his feet were up on the desk. And he was like, no, I'm busy. Just go in. And he knew exactly what was going to happen. Yeah, he said, go back in. And I said, but he doesn't want to talk to me. He's like, that's fine. Go in. Go in. Just stall. Right. And I'm like, all right, here we go. Go back in. And this guy goes, I said I didn't want to talk to you. I'm like, I understand that. You don't have to talk to me if you don't want to, but I'm here and I'm just waiting for Dr. Lerner to come in. If you'd like to tell me, maybe I can help out, but no pressure. And his response was, I don't have anything to say to you, gooks. Okay, which is a racist term for Vietnamese people. I'm not Vietnamese for anyone listening. I'm Filipino American. And so I was like, okay. And I think Dr. Lerner was trying to like just throw me in the deep end. Some teachers are like, let's just go, right?
Yeah.
This is the early 2000s. So anything went back then. So anyway, so I was like, okay, this is not a great situation, but I'm like, I'm here and I'm already going to get like a minute and a half, 2 minutes of material out of this. So let's just go with it. And so I go, I'm actually not Vietnamese. I'm Filipino. And he looked confused. And I think at this point I realized he was probably a vet. And he goes, oh, did we fight you guys? And I said, no, actually, you guys have helped us out. We're a protectorate of the United States. And he goes, oh, and he goes, how about those Japs? And I go, okay,
Damn.
No.
I'm going to step outside and I go to Dr. Lerner, and Dr. Lerner knew this guy. This is not new. This patient was not new to practice. I'm like, Dr. Lerner. He's like, He's like slinging racial epithets, and he goes, "All right, let's go." And he walks in, and they just have this immediate camaraderie. He's known him for a while, and that's why I get the sense that this was kind of like a, maybe a little a practical joke. Now, I understand that that scenario. I don't know what the appropriate way to respond is. For me, I just thought the story was so hilarious. I don't personally get offended by that, but it's not fair to people who do get offended by that, right? So, like, what if someone was Vietnamese and gets offended by that? But that wouldn't be the way to respond. For me, I just think I'm always thinking, is this something I could get a story out of? But in the case of people who feel like they're in danger or feel like this is going to go very, very badly very quickly and are in much more serious situations, I think that, you know, I think this original article you brought up probably makes sense. You can walk out and physically get yourself away from the situation, or just prevent yourself from escalating or worsening a situation by continuing to contribute to it. So, I mean, honestly, probably if I were to give a guidebook on how to do that, I'd say, okay, just walk out and don't go back in. But for me, it just became like a story, and I imagine a learning experience that my attending was trying to impart in a way that I found funny, but is probably not funny to everyone.
I mean, I got some thoughts.
Yeah,
I got
parts of
some
the
thoughts
story are
for
related.
What are
yeah.
your
No,
thoughts? Would
I
you
got I got
folks
I
have responded the same way?
well, the question is what's your position, right?
Yeah,
When you're med
med
student's
student.
different from when you're a
Hmm.
resident, from when
Yeah,
you're staff, all that
yeah,
sort of stuff.
yeah.
So the power dynamics are always at play. However, your dignity is evergreen,
Mm,
and should be ever present, and how
hmm.
you internalize things is your business, right? Like if you and just be like, there's gonna be another one of them ones, let me just ride this out, like Ryan said, like that's cool. But like I think, everybody's a little bit and everybody's a little bit different.
Hmm.
And the way that you deal with patients who are being like, they may be on a scale of aggressiveness, they may just not want to talk to you, or they may
Mm,
start saying mean stuff to you, or
sure.
they may, get physical with you.
Mm,
And so, what do you do to protect your peace of mind and also protect yourself physically? And I
Yeah.
think that the response that you choose should reflect kind of who you are. Like
mm.
trying to copy someone out the way someone else does it
Yeah, yeah,
is
yeah.
usually a
It's not
recipe
gonna
for it
work.
not quite
It's not
working.
gonna work.
And for Ryan, like, if you're like you're staff now, right? Let's
Hmm.
say you because that's where this all ultimately goes. Like when
Sure.
you don't have the power, you're a student, like everyone
Yep.
walks all over you, like, they say this stuff, you walk out, you don't have to necessarily go back in. You
Right.
don't have to
Right.
convince them to get, some surgery done or
Sure.
whatever. But when you're
Sure.
grown, you do. And
Yeah. Yeah.
so
Yeah.
what do you do? What are the skills you need to build up to be okay in that room when you're older, right? And
Yeah.
so,
Yeah.
when you have that patient come in now,
Yep. Yeah. Yeah. Yeah.
is your way through still like, because like, is your way through still to be like, okay, let me lean on my sense of humor about all this stuff
So
and kind of
yeah.
diffuse things, or like how have you
How
learned
do
to
I
do it?
approach? Yeah, so I
Yeah.
mean, that's a great question. It's a completely different dynamic, obviously, when something has to be done and the buck stops with me, let's say, in this scenario. So I have to convince someone to take a medicine or to go through with the procedure. I'll still use humor. I found that the best way to diffuse a situation personally. But what I will do is kind of really get down to the basics of motivational interviewing, which is to say, where is your head at right now? So clearly you're upset. I don't want to upset you further. So, like, what is going on? What have you, like, what kind of challenges have you had in the past? Like, have you had bad procedures that are making you nervous about this? Like, people always have a why, especially
Mhm.
when they're really, really ramped up. And sometimes, not always, but sometimes I or other providers can get at it by just calming the situation down and figuring out you are upset, why you're upset. It's reasonable for you to be upset. It's not unreasonable, but I just want to know why. And then usually you can suss it out. Not always, but sometimes you can. Sometimes you still get threats. And then you got to start thinking about your safety, make sure you're in between the patient and the door, that sort of thing. But overall, I think just trying to calm the situation is probably the best bet when you have to get something done.
Friends May, what are you thinking over there?
Yeah. No, I definitely agree with Ryan. I agree with what that lady did in this article. My policy would be if somebody is acting up over crossing my boundaries, then I will just leave. And like to Ryan's point, I'm always between the patient and the door. Like that's not like, oh, this person is giving me some weird signs, because like sometimes they turn on a dime. Like I don't know. I'm squirrely, so I'm always between the patient and the door. I am not too shy to leave. I will say, fortunately, and part of this is like on the ENT side of things, you know, Tony, like I specifically chose ENT so that I could be like clavicles and up, so that I didn't have to be in people's groins for literally any reason. Like I didn't want to see
Yeah.
feet anymore and stuff like that. So I can say in my personal experience, all those 13 years in the hospital, I probably had like patients being sexually inappropriate or like exposing themselves fewer than 5 times. And any time that happened, I just leave. Like I would just leave and I'd tell the nurse like either, you know, that guy's got to be covered or someone else has to come back in with us for us to like do the exam. So fortunately, I feel like there were kind of some like almost anatomical protections for an ENT. I feel like I can certainly relate. I had tons of patients. I've had patients stop me in the hallway of like the cancer center where we're just walking towards each other in the hallway and they'll gasp and they'll be like, wow, this is the biggest Oriental we've ever seen.
Jesus Christ.
Yeah. I mean, yeah, some parts of the country, people talk like that. And literally when that would happen, I was a resident and I would just that wouldn't even rank on the 10 worst things that would happen to me that day. So I'd just keep it moving. Like I think that the policy of like, just don't get in the weeds with people. Like I don't. I definitely, at the VA hospitals especially, patients would be like, you do look like a girlfriend I had in Vietnam. And I would just be like, so the best way that I would approach it probably algorithmically is like they almost have like a 1 or 2 strike policy. So they'd say, you look like a girlfriend. I'd be like examining their ears.
Yeah.
So I'm doing that. And they're like, you look like a girlfriend I had in Vietnam. I ignore. Literally. And because again, I don't have people pleasing tendencies. So no response whatsoever. If that makes them uncomfortable and then they just like drop the subject, then that's really okay. Because that doesn't violate my boundaries too badly. Like we'll just continue with the conversation. If they bring it up a second time, then I would be like, you know, just maybe squint at them. Still probably not engage at all. And then if they did it like a third time, I might be like, if you keep saying stuff like that, I'll just leave. So, you know, but what's interesting is that it really brings up for me, I had even in my attending practice, to your guys' points, like sometimes the work needs to be done. I was in solo practice and I had to, I had to take care of patients. One had a full sweatsuit on and the sweatsuit itself was a whole Confederate flag. So like a 6-foot Confederate flag screen printed onto a sweatsuit. And you know, I'm in solo practice. They were going to see an Asian female doctor when they came to the doctor today.
Yeah.
That was very brutal and unpleasant for me. But I will say that basically, after all that time, I never fired a patient. I was like prepared to. That person, despite the insane outfit that they were wearing, they did not then like verbally push it or say anything to me that would be like, I'm going to go get my practice manager, like straight up. So the Confederate flag wearing, I think the worst thing that I saw anyone wear to my clinic, it was this giant, it said Black Guns Matter, and it was like photos of ARs.
Jesus.
And I found that like distracting and offensive, but I just didn't engage, and that person didn't like try to start a conversation with me about guns, which I would not find appropriate, right? Like, so I mean, but it's interesting because I would say almost like offensive clothing was an interesting category of like moral injury that I suffered in practice as an attending.
Tony, what were your approach be, or what has your approach been in these same situations?
Yeah. So as you guys are talking, I'm thinking about, okay, so like what do we give folks that's actionable, right? Like, because this is disrespect from patients can come in these different flavors. And I think that whatever stage you're in, you should think ahead about, okay, if this flavor comes at me, this is kind of how I'm going to approach. So that, you know, at least you're not just deer in the headlights with a lot of these things. Because the way folks are coming at you, they're barely thinking about you is the issue. But the thing is, you need to be the one in charge. And so how do you you maintain that, right? And
Right.
so I'm thinking like, okay, they may come in and they may be, angry, and they may just be lashing out in any sort of way because they're angry. They may come
Yeah.
in and they just, you look like young and cute, and they feel that they're older than you, they know it, and you may not be inspecting their groins, but they think they can talk to you in a certain
Yeah.
manner
Yeah.
that kind of belittles you. They may think, you're too young to be doing this, and they have no problem asking. That's the most common thing that people will do.
Mm-hmm.
And then based on like kind of who you are, what your vibe is, think about how you're going to handle it. Some people, you got to be firm. They want to
Yeah.
just be like, you know what? I'm going to
Yeah.
shut this down right now. Like, okay, what you just said, not okay. I'm going to continue with what we're
Yeah.
supposed to be doing.
Yeah.
Or
Yeah.
I look too young. Like everyone has to have a good I'm too young answer. Like if you want to joke
Yeah.
about it,
Yeah.
you can joke about it. Or like, but like, or you
Have
just
it
be
in your
like, hey,
toolbox. Have it in your
yeah, have your
toolbox. Yeah.
toolbox.
Yeah.
Yeah, like,
Yeah.
listen, I'm not a teenager. Like, I graduated just like everybody else. And let's move forward.
Okay,
Like,
my
that's it. I'm
line,
grown. What's
yeah,
your line?
I had a line for that. They'd say, "Oh, but you look so young. Oh, and your skin's so perfect and you're young." And I would say, "Thank you. I'm actually very old and very tired, but it's the Botox."
That's
And
it.
they would be
That's
like,
perfect.
"Wow, yeah." And then they
Perfect.
always would drop it. And sometimes they'd
Perfect.
be like, "Where do you get
Yep.
your Botox?" Like, just,
Yeah.
yeah.
Yeah, like, and you hear that's right in the pocket of who we
I
know
love it.
and love
I love
Frances May
it.
to be. That's just who
Yeah.
she is. She just answers
Yeah.
straight up. That's who she
Yeah.
is.
She goes, it's
It's
Botox,
fantastic.
son.
And also,
Yeah.
would somebody have this like existential dread and fatigue if they weren't more than old enough? And they're like, no, that's true. Like your aura is tired in a way that no child's would be. And I say, exactly.
That's right.
Mhm.
So we
You're
agree.
gonna have to defend your existence in medicine quite a lot. And so our new mantra per Ryan Montoya, and the way he goes about his life is to do that joyfully and treat these moments as absurd because they are.
Yep.
But nothing should you shouldn't have to swallow your dignity in order to do your job. And
Mhm.
the job will push you to do that. And where you push back is really important for you.
And it's important. I totally agree with knowing yourself, but it
Yeah.
also, like, life is a series of trade-offs, and it feels really good to own your decision. So even when I talk about my attending practice, I feel like, yes, at any point I could have escalated. I could have said, this is a patient we're firing. I could have said, this is a situation where we need to get the practice manager involved.
Yeah.
But another mantra I love is this fight worth a meeting? And so
Yeah.
I can always weigh, and that's fine. The boundary, the line is different for all of us. I happen to not cross the line with someone in terms of they offended me enough that I was like, this is worth admin meetings for me.
Yeah.
And then I have to
Yeah.
explain to the hospital why some of us don't want to see the Confederate flag.
Sure.
That's not,
Sure.
we don't all agree about what's appropriate clinic gear or what isn't.
Right.
And so that's fine. And if it ever got to a level where I was like, I have to tackle this, then I would have. But I also very much own, like, that avenue was available to me. I was comforted by its presence. I
Yeah.
chose not to go down it.
Yeah. Yeah. I think that's sage advice, right? So you're not going to fight every single battle. I mean, there aren't enough hours in the day. But the ones you do kind of see to the end, you want to make sure the juice is worth the squeeze. And you're like, okay, this is something that systematically has to change. So it's worth the fight. Other times you're like, I mean, for me, sometimes it just depends on, have I eaten lunch? Like how tired I am? And like, is it worth going through all that? And sometimes it's not. But for the folks listening who have not encountered this yet or are in the middle of it and they're still in training, it'll be tough to think about it now because you feel like you don't have any power. But when you do get to a certain station, you'll almost be so used to just letting things kind of steamroll you that it's better to kind of develop these tools now, like Tony said, because when you do have to start using them or you use them more frequently, you want to know that you aren't still in the mindset that you're just going to take everything and let things roll over you. And I will say this for any people who identify as being of Asian descent, there is a expression in Japanese culture and Filipino culture, a lot of Asian cultures, which is bend, don't break, or another equivalent is the nail that sticks out is the first to get hammered, right? And this is this idea that like, do not stand out, don't make trouble. But in these scenarios, sometimes it is trouble and you got to figure out how to do it in a way that makes sense with your values, but then also is worth the fight if you were going to engage in that fight.
And also remember, not everything has to be a fight. That's why,
Yep.
I hear you guys, but also that's why the toolkit is so important because, lots of little things can be addressed and it not be a big deal. You
That's true.
know, like the ignoring of it isn't the only way for it not to be a big deal.
Mhm.
You can address it and move on with your day and with your interaction. As long as you're not feeling like blindsided by it, then of course you're going to be like, I'm going to just keep typing, so keep that in mind. But I think from all three of us, very sage advice today. And we got like a couple of minutes. I do want to get a couple of questions from Ryan's game because Ryan's got a little
Okay.
game for us,
Yeah, yeah.
probably on theme. I think
A
we're
little
playing
on
majority
theme.
minority again.
So we have
So let's do
we
it.
have a choice. We can do the majority minority. Why don't we do that? Because it's related to what we just talked about. So let me
Mhm.
pull this up here. I'm not as much of a seasoned pro as you folks. Okay, so our two esteemed hosts, Francis May and Tony, have both identified as minorities in the past based on their ethnic backgrounds, gender, and even their views on Taylor Swift and Travis Kelce. In these fraught political times, we thought it prudent to stoke the flames of division and discuss how both our social rounds hosts parse their minority status. It's time
Chaos
for
Muppet.
that's right.
Yes.
It's time for majority minority, where they really are taking our jobs. Okay. So, in this second installation of Majority Minority, we're going to pose a set of two questions that go deeper than last time. So, the first question for both of you is when was the last time you experienced racism, whether inside or outside of medicine? And either of you can go first. Yeah.
Tony lives in a dream world
I
outside
know.
of the country.
I love the
It's
fact that we're
been-
thinking. That means we've made a lot of progress.
It's been, we
folks.
made some progress. It's been a long time.
Yeah. Yeah.
Like I think since I moved to England, this is not to say there's no racism in England, because
Sure.
there is.
Yeah.
But my threshold is really high in general just because of, my
Yeah.
life. And
Yeah.
so not much has reached that threshold since I've moved.
Nice.
However, I think the last racist, I don't feel great thing was back when I was living in Los Angeles.
Mm.
And I was living in like the valley. And, every Sunday, I think this is during Trump's first term. No, actually even during Biden time, like there would be these MAGA big pickup truck rallies that would shut down Ventura Boulevard, which is this big
yeah.
thoroughfare right near my house.
San
And
Fernando
so I
Valley.
would go shopping on Sundays, and then all of a sudden there'd be just this massive caravan of these
Mm.
Confederate flag waving, like yelling at people like from the truck, like people, like whole families, kids in the
Yeah.
back,
Yeah,
all
yeah.
this sort of
Yeah.
stuff, just slowing
Yeah.
down traffic. And
Yeah.
I'd be like, great. So I got to turn around and go home.
Got it.
There'll be no
Got it.
shopping today. That's
Got
awesome.
it.
And
Got
that would
it.
happen with regularity, like once a month, I think, on Sundays.
What a bummer.
Just in Los Angeles. We're not anywhere,
Yeah.
in
And like
the
a
dirty
big
South or
city.
anything like that.
Yeah,
In big
big
city,
city.
known to be democratic in general. But,
Mhm.
that was I think that's the last set of racist things that I
Yeah,
remember.
that you experienced.
Yeah.
Francis May, you got one? You look like you're deep in thought. You're noodling over there.
Yeah, honestly, what we talked about, like, I
Yeah.
think in practice, that was a lot of,
That was the
like,
last
the worst
time.
of it, and
Yeah.
I'm
Mm.
10 months out. I'm 10
I
months
love that.
sober from
I love that.
that life and,
Yeah,
like,
yeah.
the barrage. I would say it was
Sure.
pretty constant there.
Interesting.
And
That's
that's just
really
part of,
interesting.
like, well, because I converted to now, like, more work from home. So, like,
Yeah,
in my
yeah, yeah.
house with my cat and my dog, is anyone
Sure.
racist towards me? No.
Sure.
Like, and I, like, DoorDash
Yeah.
food once a week. Like, no,
Yeah,
I mean, my life
Sure.
now, I have the privilege of just, like, working with people who
Yeah, we're not
make me feel
outside
more
anymore.
seen. Yeah,
We're
like,
not
I
outside
really,
anymore.
like, don't venture
That's
out into
right.
public that much.
But I
This
do
is gonna
think
make me sound like I went full recluse. I have one
No,
idea,
no.
though.
I
for-
feel kind of the same way. Like I feel kind
Yeah.
of tucked away up
Yeah,
here, and
like,
I
I'm
don't leave
protected.
the house all that much. So
Yeah.
I feel
nice. That's good.
it's all about the level of violence and threat that you
For
feel.
sure. For sure.
Because we're not finding any place that doesn't have racism. It's just, is it going to kill me today?
Correct. And is it worth it to
Not when
address?
I
And
work from home. Yeah.
that's right. So my theory, I have a pet theory, which is probably not original, and it's that airports and hospitals are very similar because you have people at the extremes of both emotions. They're either really, really happy because they're leaving or they're seeing someone coming in from the airplane, or they're really, really upset for those same reasons. The hospitals are the same way. People are living or they're dying. And so because of that, you're going to interact with the most extreme examples of behavior, the most racist behavior, the most angry behavior. How many videos have you seen of people losing it on airplanes? Because at the point that you're on an airplane, you've gone through all of this mess and you're really at the extreme of your emotions. You might say the worst things. And this is not excusing people for saying these things, but that's probably why all three of us have more often encountered racism in the clinic, because it's the extremes, right?
Sure.
People are there, they're sick, or they have problems, they need medications, and what's going to come out? Not like some really kind of well thought out, metered response to something. Instead, it's going to be, your lizard brain going nuts. So, my follow up question to this, which I think we've already kind of addressed, is, um, you know, what level of racism do you have to experience before you actually say something? And so for Tony, what I'd ask is, I don't know if anyone's ever talked to you with a black scent, but if someone gave you like a 20 or 30% black scent, would you say anything? Or you're like, it's not worth it. I'm just going to go about my day. Or like, does it have to get like 50 or 75% where you're like, dude, stop it, calm down?
I mean, I think, specifying the experience to the black scent, I think is fun.
Yeah.
I have not heard that towards me in a very long time. However,
Awesome.
my tolerance for it is currently very low. And so I could get hit with, like, if I could suss out a 15% to 20% black scent, if I've been really listening, I was like, no, actually, I like how you said chicken like that. Then I'm just going to ask them, like,
Yeah.
are you pleased with that?
Yeah,
You
good,
pleased?
good. So you'll
Are you
address
happy
it
with
on
that
the
choice?
spot.
That
Good,
choice
good,
of
good, good.
to say it like that? Because
Understood.
my years of being scared of these interactions are long gone,
That's
and
awesome.
I'd much rather frighten
Address it.
someone into
Yeah, yeah,
doing a
yeah.
little better with other people because one
Nice.
person decided to tell them to shut the fuck up.
Yeah, yeah, yeah. Nice. I like that. Francis May, have you ever gotten whatever the equivalent is for us, the yellow accent or something? Have you ever gotten that?
Yeah,
anyone
honestly,
lead with?
I mean, in middle school, yeah.
Yeah.
Like, I would
Mm,
say in my
Yeah.
hometown, like
middle
that,
school.
yeah,
Yeah.
100%,
Yeah. I got it during the
100,000,000%.
pandemic. I got on
You
a
know,
bus in the pandemic. Yeah.
really? You got it during the
Yeah.
pandemic? No,
Yeah.
that's too
Someone said,
recent.
"Oh,
I
go
mean,
back to your country." I'm like, Jesus Christ.
where
It's a double.
where were you?
I was on the
Uh,
bus. I was in DC. I was working during the pandemic. I was working at Planned Parenthood. I was also working at MedStar and George Washington. And like, this is the time of COVID when we didn't know what the fuck was going on and we thought we were going to die. And I remember I was on a bus and first of all, one family who didn't say anything moved away from me. I'm like, I'm here, guys. I didn't come directly from Wuhan. And then another guy was like, he didn't do full yellow accent. It was like, go back to your country. But like, it was like a little, there's a register that was a
playing
little
with
bit.
Yeah, that's
in his head.
crazy.
He thought he was really cooking with that
That's
accent.
right.
Yeah,
Yeah.
No,
But I
but
mean, I haven't gotten it since then.
That's
It's
a pretty
not
good one.
subtle.
Yeah.
yeah, but they
And
were like
it's
beating
tucked into
up
the
old
percentage.
Asian people in the streets. Like, it
For
was
sure.
awful.
Yeah, yeah.
And
Yeah, it was brutal. Yeah.
but in the 90s and early
You
2000s,
got it.
in that little town,
Shit.
I don't know where the kids even knew. They'd be like, they'd corner me at lunch and be like, "Is it true that all Asians have red pubes?"
Jesus Christ.
And I would, yeah, and I would be like, I don't know what I was like, what are pubes? Like, I don't even know what conversation we're having.
Kids are fucking
They
awful.
were crazy.
They are
so
awful.
that's
Yeah. So in
Oh,
that
man.
case, will you say anything or you just kind of let it slide because you think that they're trying to be nice?
I will say, I think compared to you guys, I mean, again, I've spent time with Ryan in real life. He
Yeah.
is lovely. I definitely see the chaos Muppet. I see the joyful troll within, but like, he's lovely, and I can see why people think that they can say whatever they want to him. Tony, you also seem to be a person who's like maybe smiling at people a lot. That's not me saying that you deserve it, but like you're putting off some vibe that's like, you can come talk to me.
No, I'm inviting.
saying-
I have an inviting sort of vibe.
For sure.
Yeah.
And
for
I'm
sure.
saying that I am literally the opposite. I'm like, you better really have something to say
You better
if you're
come
going to come
correct.
talk to me. Please don't come talk to me. And
Mhm.
I really think that like that's stamped on my forehead. My eyes are saying it. My mouth is saying it. It's like one
body
hard pressed
language.
line across like the emoji. Like I just
Mhm.
don't. And so people do not, I think that they say stuff to each other. I think they think things,
Yeah.
but I'm happy as a clam because I'm
Yeah.
like, do not bring it to my doorstep. It's
Got
very
it.
menacing, but I'm
Yeah.
just, I think that like it already invites less trouble into my world because I have a default status, which
Saying
is like, don't fuck
you,
with me at all.
come correct, or don't come at all. Yeah.
Yeah. For
Well,
me,
yeah, Ryan, we've met in
for me,
person.
I'm setting a trap with my general genial demeanor, just
like a
inviting
Trojan
you.
horse. You're like, but you're
Yeah,
gonna
I'm just
learn.
like
Yeah,
inviting
that's
you
good.
to be yourself. Please be yourself. But if you're not being yourself, I'm gonna let you hang yourself
I'll let
with,
you know.
with
Yeah,
all
yeah.
that bullshit.
Yeah.
And then we're gonna
Yeah.
talk about it. And it's gonna be
Yeah.
tough on your end,
Yeah.
bro.
Yeah,
Because
but
I'm
we'll
not,
do
I'm not playing anymore. Well, if you are considering putting any sort of accents on in the presence of Tony Ryan and Frances May, do it at your own peril, guys.
Be warned.
That's what you're gonna do. No matter which one of us you're talking to, you're gonna get dealt with, in whatever way we see fit. But we still love you. Listen to the podcast. Anyway, with that, another successful and legendary episode of Social Rounds comes to an end. Frances May, please.
If you enjoyed this episode, please subscribe, rate us 5 stars, and leave us a review. Check out our other shows and content at hippocratic-collective.com. Thanks again for tuning in, and we'll see you next week.
Bye.
Bye.